Welcome to the Woman's Connection. I'm Barrie-Louise Switzen, your moderator. The Woman's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned?
Welcome. Today we're going to talk about a problem that's in the category of silence is golden, but not if it affects your health. And this problem affects 85% of the women population. What I'm talking about is incontinence, urology issues. And with me today is Dr. Philippa Cheetham, and I would like to welcome Doctor.
Thank you very much for having me.
Thank you for joining us. The things that I was really floored by when I was doing some research on this topic was that Benjamin Franklin created a tool that is still in use today. But more important, why don't we just talk about what about women in incontinence and other urology problems?
So 13 million people in the United States suffer with urinary incontinence. And although we're focusing on talking about women today, it does also affect men, often after surgery. But with women, there are numerous causes of urinary incontinence. And incontinence means involuntary leakage of urine. And I was taught as a medical student that the bladder is a very poor witness. And what that means is that irrespective of the cause, the bladder really only has one way to sulk, to show its unhappiness, and that is with frequency, urgency, leakage. So the symptoms do not necessarily lead you to the cause, and there are many causes for urinary incontinence, involuntary leakage of urine.
Well, what would you say are some of the causes? Is it psychological? Is it physiology?
It can be both. First of all, there's essentially two types of incontinence. There's what we call stress incontinence, when the supports of the pelvic floor are weakened. So in women that have had children, the supports around the bladder neck between the bladder and the urethra, the tube through which you urinate, the supports are weakened. So normally what happens is that the pressure in the urethra, the tube that goes from the bladder to the outside, those pressures are higher than the pressures in the bladder, and so you remain dry. However, if the pressures in the bladder overcome the weakness in the urethra, you will leak urine. So anything that causes a rise in the intra-abdominal pressure, the pressure in the abdomen, whether it be coughing, sneezing, laughing, lifting, these things will result in leakage of urine, what we call stress incontinence. And the pelvic floor weakens after childbirth and also weakens as ladies get older and they approach the menopause, because the pelvic floor is very dependent on estrogen. So stress incontinence is one form of incontinence. On the other side, we have a incontinence called urge incontinence, which is when the leakage is preceded by urgency. When you've got to go, you've got to go. And this is related to the bladder muscle, not the pelvic floor. So they're very different types of incontinence, but they both result in involuntary leakage of urine.
Does this also happen with women who've had hysterectomies?
It can do. And in women who've had hysterectomies, the supports of the pelvic floor are affected. So having had a hysterectomy is one of the risk factors for incontinence, what we call stress incontinence, because the anatomy has been disturbed. And the pelvic floor is like a hammock. And within that hammock, at the front is the urethra, in the middle is the uterus, which is what is removed when we perform a hysterectomy, and at the back is the rectum. So the pelvic floor, if it's weak, it can affect bladder control, it can affect the uterus. If present, you can get a prolapse where the uterus may sag down into the vagina, and rectal problems, fecal incontinence can be as a result of weakness of the pelvic floor as well. So ladies often present with more than one problem if there's weakness of the pelvic floor muscles.
Is there exercises that you can do to help build it up?
It's a great question. And stress incontinence, there are some very simple things that ladies can do in the beginning. The first thing is that if you have a chronic cough, the more you cough, the more likely you are to leak because you're increasing the pressure. So if you're a smoker and you have a chronic cough, often ladies who smoke, they have more problems with urinary leakage when they have a bad chest and they continue to smoke. So stopping smoking can actually help your bladder control. Number two, if you're overweight, there is more pressure on the abdominal cavity. So weight loss can significantly improve bladder control in ladies with stress incontinence. We also know that if you have issues with stress incontinence, simple pelvic floor exercises, what we call Kegel exercises, can help. And physiotherapists who specialise in bladder control can teach ladies how to work the muscles of the pelvic floor. So these are very simple lifestyle changes that can help. And sometimes just improving urinary symptoms, not necessarily resolving completely, can make a huge difference to somebody's quality of life.
Well, many years ago I heard something about if you wore a Tampax when you were exercising, that would help from the leakage. Is that true?
Well, that doesn't really make sense because a tampon is sitting in the vagina and the leakage is coming from the urethra, from the bladder. However, there may be some pressure from the back towards the urethra that may or may not help. But there are many other things that you can do to help reduce leakage.
Well, I remember hearing about this one senior woman. She must have been in her 80s. She was going for a rubber band treatment or something. What exactly is that?
Well, I think what you may be talking about is a pessary, which is a ring pessary. It's made of rubber and it sits in the vagina. And in older ladies, it can be used to treat a prolapse by just supporting the pelvic floor. There are many other better treatments, especially for younger women, but for older ladies where there may be an anaesthetic risk and you may not necessarily want to do a surgical repair, then a pessary may be an option. But they're not without risks. They can cause erosion and inflammation and infections. And nowadays, surgery for stress incontinence has come a long way. So we can do day case procedures where we can do different surgical procedures to restore the anatomy by what we call either a TVT, where we can lift the supports of the bladder either from the abdominal cavity or down below. We can support the bladder neck and urethra to prevent leakage.
Now, now you mentioned something about estrogen.
Yes. So there is a triangle at the base of the bladder called the trigone, and that's within the bladder. But the trigone in women is estrogen dependent. And as women get older and they approach the menopause and the estrogen levels go down, the trigone, this area in the bladder that likes to have estrogen, is lacking in estrogen. And this can result in inflammatory conditions. It can result in frequency and urgency. And so often hormone replacement therapy can actually not only improve symptoms of menopause, such as hot flashes, but it can also help women with their bladder symptoms as well.
What if somebody has breast cancer in the family? How do you adjust for that?
Well, we have to be very careful about prescribing hormone replacement therapy in anybody who has a risk of breast cancer. And so it's about balancing the pros and the cons. And so if a woman has a strong family history of breast cancer and we are concerned about hormone replacement therapy, there are other things that can help, such as lubrication. Sometimes we use topical estrogens and we balance that with progesterones. But if we have concerns, we would talk to the breast surgeons about the risks, the pros and cons of treating the menopausal symptoms versus the risk of hormone replacement therapy in those who are at higher risk of diseases such as breast cancer.
Now, there's something that I read in your PR papers that said something about Botox.
That's right. So Botox, obviously ladies know about Botox for treating the crow's feet and the wrinkles on the face. And Botox is a neurotoxin. It's derived from Clostridium. And Botox is a neurotoxin, a nerve toxin that causes paralysis of muscle. So it stops you screwing up the muscles around your face, and it takes away the wrinkles. In the bladder, we can use Botox to inject into the muscle. And if we inject Botox into the muscle of the bladder, then it will paralyze that part of the bladder muscle. So if you have a very overactive bladder, instead of filling and emptying, it's very overactive. If we selectively inject Botox in 20 or 30 areas of the bladder, where we inject it, the bladder muscle is paralyzed. In the surrounding areas, the bladder muscle is unaffected. So it can really change an overactive bladder into a bladder that is allowed to fill and empty. And so that can make a huge difference. Unfortunately, it doesn't last forever. In the same way that if you have Botox for your wrinkles, it needs to be repeated because it does wear off. But that's a good thing as well, because sometimes we can give you a little bit too much and the bladder may not empty at all. So it's trying to find that fine balance between damping down the overactivity and not going too far the other way. But this is a minimally invasive treatment that we've been doing for patients for over 10 years and has recently received FDA approval in the United States for people with overactive bladders associated with neurological conditions, for example, spinal cord injury. But hopefully it won't be long before we have FDA approval for using Botox in overactive bladders for people who do not have neurological conditions. And so we often use Botox off-label for that purpose at the moment, but it will be fantastic when this becomes FDA approved for patients with overactive bladder.
You said that it needs to be redone. How long does it last?
It varies with different patients, and some patients need repeat injections approximately every 4 to 6 months. Other patients can go longer, 9, 10, 11 months. But the good news is that if a patient benefits from this, it's a quick procedure, it's not invasive. We can actually go through the urethra. We can do this in the office. So it's not like a major operation. In many cases, we don't even need to put people asleep to do this. We can do it with local anaesthetic through a fine telescope called a cystoscope into the bladder. So it can really make a huge difference to patients' quality of life and significantly reduce urinary leakage.
Don't get old. You brought some food, and one side is good food and one side's bad food. Do you want to explain?
Absolutely. So I've tried to divide the table into 2 categories. And these foods and supplements are very good for the bladder. And this side are the bad bladder irritants. And I'll just explain some of these. So we know that coffee, alcohol, fizzy drinks, so this is sparkling water, and here we have soda, and Coke, which is also not only contains caffeine but has carbonated water as well. These are all bladder irritants.
You also have a tomato.
That's right.
And I know grapefruit is a good diuretic if you want to lose a quick 5 pounds. And then you have lemon. But the worst thing that you've got there is chocolate.
That's right. So let's talk about the front row. So citrus fruits are quite acidic and they can really aggravate people who have an inflamed bladder. So grapefruit, lemons, tomatoes are quite acidic. So if you have a very overactive bladder, some patients find that having these in the diet can really exacerbate symptoms, and eliminating things like tomatoes and citrus fruits can help. In some patients with inflammatory conditions of the bladder like interstitial cystitis, chocolate may be a trigger, and chocolate, Coke and coffee are all rich in caffeine, which is a bladder stimulant. So I would advise patients to stay away from sparkling water, alcohol, fizzy drinks, soda, caffeinated drinks. We also know that coffee, even decaffeinated coffee, can aggravate the bladder. And tomatoes, many patients say that tomatoes and also spicy foods can aggravate the bladder. So these are the things for inflammatory bladder conditions, overactive symptoms like frequency and urgency. Trying to eliminate these can really make a big difference. On this side of the table, we have a very different collection. So here we have still water as opposed to sparkling water. We know that cranberry juice can really help ladies who are prone to recurrent urinary tract infections. And the reason for that is that cranberry juice contains a chemical called proanthocyanidin, which prevents the feet of bacteria from sticking to the bladder wall and causing invasion, resulting in urinary tract infection. So this can really reduce the number of antibiotics somebody may need if they're very prone to urinary tract infections. The problem with cranberry juice is it can be quite rich in sugar, and there are cranberry capsules that will give you the extract without needing to take a large amount of the cranberry juice itself.
Would you say a cranberry juice a day is the best thing for you, like an apple a day?
I think it depends on if you're prone to recurrent urinary tract infections. We know that cranberry juice is very rich in oxalate. So if you're prone to kidney stones, oxalate-rich foods you would want to avoid. So many patients get confused and say, well, I hear that cranberry juice is good for your urinary system, which is very true if you're prone to recurrent urinary tract infections. But if you're a kidney stone former, then cranberry juice being rich in oxalate is something that you would want to stay away from.
So you got to decide which you are.
So it's best to discuss with your urologist. In addition, we also have two ingredients that will boost your immune system. So vitamin D deficiency is associated with many medical conditions, including breast cancer and prostate cancer, in fact. But we know that vitamin D, what we call the sunshine vitamin, is not only good for your bone health, but also good for your immune health. So having a vitamin D level checked, and if you're deficient, vitamin D can really help. This is a mushroom ingredient called AHCC, and this is derived from the roots of a Japanese mushroom. And there are cells in the immune system that circulate in your blood, looking for inflamed cells, infected cells, even cancer cells. So this immune supplement, which comes in a tiny capsule form, can really help boost your immune system. And if you're prone to recurrent urinary tract infections, that can help. For patients who don't like to take tablets, this mushroom ingredient also comes in a powder format, which many patients can just incorporate with their cereals or in smoothies. We also know that green tea is very rich in antioxidant. There's polyphenols in green tea that can reduce inflammation. And this is a herbal extract called Zyflamend, which contains 8 different ingredients, all natural, that can really reduce inflammation. And we've done a lot of work at Columbia University looking at Zyflamend for reversing precancerous changes in the prostate, but it has significant anti-inflammatory properties. So everything on this side of the table is good for your bladder, and many women know about cranberry juice and cranberry juice capsules. But these extra things that you can do to boost your immune system, like vitamin D supplements, the anti-inflammatory, the Zyflamend, and the AHCC mushroom ingredient, these are extra things that if you're very prone to recurrent urinary tract infections, then this can significantly reduce the number of antibiotics. And of course, if you're taking a lot of antibiotics, antibiotics will kill the good bacteria as well as the bad. So many patients with recurrent urinary tract infections are then prone to thrush, where they get fungal infections. And so it's very good to add a probiotic into your diet or take natural live yogurt to protect against the effect of the antibiotics wiping out the good bacteria that put you at increased risk of Candida infections, thrush, which is very related to recurrent courses of antibiotics.
Would you just explain what thrush is?
So thrush is a yeast infection. And so if you take antibiotics and it wipes out the good and the bad bacteria, the healthy bacteria will keep the thrush, the yeast infections, suppressed. But if the good bacteria have gone, what we call the lactobacillus, then the yeast infections will take over, and you can have a very annoying vaginal discharge that's itchy and causes a lot of inflammation. So many women develop thrush, what's called Candida. And so these natural yogurts and probiotics can help restore the good, healthy bacteria that are present in live yogurt and probiotics.
Let's go to urinary tract infection. What will cause a urinary tract infection?
So urine in the bladder is completely sterile. However, what tends to happen is that bacteria from the rectal area can enter the urethra, which is the tube going from the bladder to the outside. And when bacteria enter, they can feed off the urine, and then you can have invasion of the bacteria onto the bladder wall. And then once you have invasion, you have a urinary tract infection. If that infection is confined to the bladder, what we call cystitis, it can cause urgency, frequency, pain on passing urine. If very severe inflammation, it can result in blood in the urine. If the infection goes upwards towards the kidneys, it can cause a kidney infection, what we call pyelonephritis. And many women, 4 out of 5 women, will suffer with a urinary tract infection at some point during their life. And in women, the urethra, the tube through which you empty your bladder, is very short. So the bacteria have a very small distance to travel into the bladder, whereas in men, the urethra is at least 4 times as long. And so men are far less prone to urinary infections, cystitis, than women.
You also mentioned interstitial cystitis.
So interstitial cystitis is the bane of the urologist's life and also of the patient's life for those who suffer from it. Interstitial cystitis is a chronic inflammatory condition of the bladder which affects many more women than it does men. We do not really know what causes it. It's a very difficult condition to diagnose and it's a very difficult condition to treat, but it often presents with very severe urinary symptoms, very severe urinary frequency, urgency, incontinence. Often ladies that have interstitial cystitis, they have a lot of pain. If they can't get to the toilet to empty their bladder, they get a lot of pelvic pain in the bladder area. And it can be a very, very difficult condition to diagnose, and it can be extremely difficult to treat. And we know that there are many exacerbating factors. Like so many medical conditions, it can be exacerbated by stress, by some of the foods we've already talked about, which aggravate the bladder. And for many patients who have flare-ups, it has a huge impact on their quality of life. It can be a very, very distressing condition to have.
If the symptoms are so painful, how come it's so difficult to diagnose?
Well, when we look inside the bladder, regardless of the cause, we see a very red, angry, inflamed bladder. And if we were to biopsy that bladder and take a little piece of tissue from the bladder and look at it under the microscope, we see many signs of inflammation, but they're often very non-specific. So we see lots of white cells, the signs of infection. We see lots of inflammatory cells. But there are certain conditions that we see in the bladder associated with interstitial cystitis. We can see ulcers, what's called Hunner's ulcers in the bladder, but only 10% of patients with interstitial cystitis will have these ulcers that absolutely define the diagnosis histologically. And so when we see this inflammatory condition, we often don't know whether it is truly an interstitial cystitis, and it often responds very poorly to many of the treatments that are out there, and patients tend to have recurring episodes of relapses of the problem associated with stressful events or trigger factors in the diet.
What advice would you like to give the public that they don't really know about?
One of my real bugbears is that smoking causes bladder cancer. And when you see a cigarette packet, it so often says smoking kills, smoking causes heart disease, smoking causes lung cancer. But the number one cause of bladder cancer is cigarette smoking. So I would urge all the viewers to remember, if you smoke, you are massively increasing your risk of developing bladder cancer. And if you have bladder cancer and you continue to smoke, you are much more likely to die from your disease and for your disease to progress and be recurrent. So you are doing so much for your general health and your bladder health if you stop smoking, because smoking causes bladder cancer.
That's a new one. Because I know when you think of smoking, you think of lung cancer or throat cancer, but never bladder.
And we do very occasionally see bladder cancer in patients who've been lifelong non-smokers. But by far the majority of patients I see with bladder cancer, they are smokers, and smoking has a significant effect on the lining of the bladder. And those patients that continue to smoke will be much more likely to have a recurrent cancer.
I'm overwhelmed. And we've run out of time. So in the closing moments of the show, Doctor, what would you like to leave the audience with?
So I would advise patients, if you have symptoms of frequency, urgency, pain on passing urine, or if something doesn't feel right to you, or you have leakage, first of all, go and get investigated, because the treatment very much depends on the cause. Many patients believe that their doctors can't help them. They accept it as a sign of aging, or they think it may be related to having had children. But we can really do a lot to improve patients' symptoms. And we do know that some conditions are serious. So bladder cancer can also present with frequency, urgency, blood in the urine. So it's important to be evaluated early so that we're not missing something that's serious. And for these non-serious conditions, there are many simple lifestyle changes that we can advise once the patient's been fully investigated.
Well, Doctor, thank you so much for joining me today.
Thank you very much. Thank you for having me.
My pleasure. Thank you for joining us. I'm sure you've learned a lot about your health tonight. If you have any questions, please write us here at the Women's Connection, and we'll be glad to get the Dr. Cheetham to answer them for you. Or, well, I can't answer them. So look forward to hearing from you. Bye now.